Good afternoon, everybody. My name is Chris Bruni. I am the Vice President of Sales for Security Health Plan and joined by my co-host, Jeff Tucker, who is the Vice President of Business Development for the Marshfield Clinic Health System. We're really pleased to be bringing you a topic that is not COVID related today. So this is kind of exciting. We talked about COVID. We've had a lot of these webinars over the last 9 or 10 months and focused on a number of topics, but today's is more universal than just on COVID. So looking forward to this. I'm getting a little feedback on my speaker, so I'm going to try to keep my comments short a little bit. But just so that you're aware, we do have this chat feature and Q&A in the upper right-hand corner of your screen. Please feel free to use that. We do want to hear from you. We want to address all questions that come in. And Jeff and I, along with Jen Help, who is our hostess with the mostest here, we'll do our best to get those answered during this presentation. If it doesn't get answered during the presentation, we will follow up and make sure it's addressed in the information that's sent out to everybody that has pre-registered. So if you did pre-register, Jen will get the presentation out to you within about 24 hours of it ending. It's also posted on the Security Health Plan COVID-19 webpage. So there's for the COVID-19, you'll get there right at the beginning. There's an employer tab, and under that tab, you'll find all of our presentations. So this one and all the others will be out there as well, and feel free to peruse those at your leisure. Looking forward to today's topic. So without further ado, I'm going to hand it over to Jeff to finish the introductions.
Thanks, Chris. I've personally been looking forward to this webinar. This one is entitled, What is Usability? Why is it important? How do I do it? And we'll have John Welch and Andrea Mankey talking about what is usability testing, what are its benefits, what is the process and how do you do it, why is design research and testing important, and what is the financial importance of usability testing. And the reason I think that this is really interesting is I think it's directly pertinent to virtually every business that exists. You all have to interface in some fashion with a customer. And this is the team that when you provide feedback to us, they'll talk about their methodologies and the way they go about it, but they do the testing, the research, the background, you know, and I'm not even going to get into the really cool things that they do and how they do it. With that, I'm going to introduce John Welch. John is the Director of Strategic Design. He leads Marshfield Clinic Health System's customer experience team, which focuses on researching, designing, and delivering services that match customer needs. John joined the system from the Boston Consulting Group, where he helped organizations improve customer experience, digital services, and innovation practices. Andrea Mankey is a lead design researcher on the customer experience team. Her focus is on the user experience of electronic health records and other complex medical systems. She is currently pursuing a doctoral degree in biomedical and healthcare informatics from the University of Wisconsin-Milwaukee. With that, I will turn it over to John and Andrea.
Thanks, Jeff. So just a couple of comments before Andrea can really get started with the meat of what we wanted to present for you today. Our team is fairly new to the system, and so we just thought it'd be great to give a little bit of behind the scenes on kind of two things, a 2-for-1 here. One is just showing a little bit of how we're trying to be responsive to the people we serve as a health system. And then the other component of this is, as Jeff mentioned, it's the usefulness per your organization or your business as well around these concepts of usability and user-centered and user experience design. So yeah, just a little bit of a 2-for-1 here, and a short kind of case study as well at the end about how we're applying this within our system to our billing statements and looking at kind of the financial aspects of care. So with that, I'll hand over to Andrea.
Great, thanks. My name is Andrea Mankey, and as I mentioned, I'm a lead design researcher with the customer experience team. And I would just mention that I've been with the health system for about 20 years now. So today we want to talk to you about a couple of things. In general, what is usability testing and how do we go about it? And then we're going to talk about a recent project, billing statements, as an example case study. Okay, what is usability testing? So some of you have most likely heard of usability. Usability is often referred to in several different ways. Simply usability, human-computer interaction, usability engineering, human factors, user experience design, interaction design, industrial design, just to name a few. For this purpose of this discussion, these terms are pretty much interchangeable, and we won't focus on the semantics. So usability testing reveals how easy or difficult it is for your customers to use your product or service. These revelations steer product design. User experience research is the intersection of business needs and user needs. User experience is everything that affects the user's interaction with that product. Also, when we talk about a product, this can cover a wide range of things. It could be a billing statement, which we'll talk about in a bit. Some other types of products we've recently researched include our patient portal called My Marshfield Clinic, our mobile app, telehealth appointments, and other digital services. So I touched upon what we mean by a product. Now a little bit about how we think about design. Design is the rendering of intent. This comes from Jared Spool, who's known very well in the usability community. Behavior is the medium of design. When we encounter a user's behavior that isn't what we've intended, we change the design until we see what we want. And this comes from Robert Fabricant, also well known in the usability and service design communities. So what's the process of usability testing? It starts with end users. Get a hold of some representative end users, whether they're employees, patients, or customers. Tasks, ask the users to perform representative tasks with the design. And most important, observe. Observe what the users do, where they succeed, where they have difficulties with the user interface. Just try to shut up and let the users do the talking. Usability evaluations deal with a number of dimensions: learnability, efficiency, memorability, errors, and satisfaction, to name a few. So how do we go about usability testing? What are the methods? There are different phases of usability evaluations: discover, explore, test, and listen. We have lots of different methods in our toolkit that we can use depending on what phase of the evaluation we're at. But the methods aren't necessarily mutually exclusive to any one phase. They can usually be adapted for different phases when necessary. And these are just a few of the methods in our toolkit. During the discover phase, we may do field studies, diary studies, user interviews, stakeholder interviews, requirements and constraints gathering. During the explore phase, we may do competitive analysis, design reviews, persona building, task analysis, journey mapping, prototype feedback and testing, that's one we use a lot, user stories, and card sorting. During the test phase, we often use qualitative usability testing, whether that's in person or remote, benchmark testing, accessibility evaluations, and then finally the listen phase, which is often during the product's post-production period. So here we might conduct surveys, data analytics reviews, search log analysis, usability bug review, and frequently asked questions reviews. So why is design research and testing important? The biggest challenge healthcare organizations face is not how the market or different technologies work, it's how humans work. When usability testing is conducted using right techniques, it avoids you from building a product wrong, which in turn saves you a lot of time, money, and other precious resources. It is the most convincing support for your product and your service decisions. What users say they do versus what they actually do are often very different things. And the only way to verify is to observe them actually interacting with your product or service. An example is that I often ask participants to rate tasks I've asked them to complete with a product. How easy was that task for you to complete? And how confident are you that you completed that task successfully? Participants frequently tell me the task was easy and they're confident they completed it successfully, when in fact, they failed to complete the task at all. This is why it's so important to actually observe people interacting with your product. So the lesson is test early and test often. A user interface is like a joke. If you have to explain it, it's not that good. So what's the financial importance of usability testing? According to Forbes, Amazon's Jeff Bezos invested in usability 100 times more than in marketing during the portal's first year. According to Bezos, the strategy was the one that led to Amazon's overwhelming success. According to Jacob Nielsen, who is known as the grandfather of usability, businesses that spend only 10% of their budget on usability improvements see, on average, a 135% increase in their desired metrics. So the ROI of usability is significant. This is a quick and dirty example of usability ROI. In this example, improvements made to a design based on usability findings increased efficiency by 3 minutes per screen over the legacy process. For this example, we could think of a provider working with an electronic health record. So if you take this efficiency across 50 users who access this functionality a minimum of 10 times per day over 230 days, the savings is over $300,000 a year. So the efficiencies really add up. And in this case, if we were referring to an EHR, I would say this is a very underrated cost savings if we found even a minute per screen. What are the benefits of usability testing? Implementing usability practices allow you to ensure user satisfaction with a product, to see how successful users are with their tasks, to get user reactions and feedback about the product, and to gain direction on adding new features. Can users get to the new features? Can they use the feature? How does the new feature interact with the existing interface or the existing features? This point currently applies directly to the mobile app we're designing and continually adding new features to. The benefits also verify that design goals are met, match business decisions to real-world use, and to have highly usable interfaces, which stands out in the competitive market. So now I can talk a little bit about a project I'm currently working on with John. The billing statements. A little bit of background, our billing statement department requested us to reach patients or research patients' understanding of billing statements. Is the information presented understandable? Can users take the proper action based on this information? So some of the objectives were to identify where and why patients are having problems understanding billing statements. I'm sure everyone can speak to having issues with some sort of billing statement you've received. So this is sort of a universal challenge. Identify opportunities for improvement for billing statements. Explore other ways we can improve billing statements. Some of the steps involved in the billing statement project: pre-planning, what are we going to test? Planning, how are we going to test? Preparation, who are we going to test with? Testing, what does the actual usability test look like? And results, what do we do with our observations? So during the pre-planning phase, we had stakeholder meetings with the billing department. What are we going to test and why? And we decided we were going to test the paper billing statements patients receive in the mail. Why? Understand the barriers patients face, especially using some of the online automated tools available to them. What prevents patients from making timely payments, and how can we make improvements? So this is really about the bottom line. Planning, how are we going to test? So we decided with remote moderated usability testing. This is since last March, mainly driven by COVID. We do have a lab where we can do in-person testing, but we've quickly learned how to efficiently do remote testing with patients. We originally scheduled 12 patients. We had 2 cancellations. The literature shows that if you have 7 participants, you're able to find approximately 80% of the usability issues. So whenever possible, I try to schedule more, like more in the 10 to 15% range or 15 participant range in order to ensure we're finding as many usability issues as we can. The sessions are one time, 1 hour. Participants receive a $25 Quick Trip gift card. The evaluations took place January 15th through 25th. We met via WebEx meeting and we shared screens and also shared audio over a mobile phone call. The screens and audio were recorded. The reason we do this is I can go back and do an analysis and find where there's patterns for areas of improvement. During the evaluation, we reviewed 5 different sample billing statement scenarios. I asked directed questions for each statement. I also explored items of interest that came up organically in more depth, and also followed up with any particular experiences the patient may have had and any unmet needs they may have had. So who are we going to test with? For this project, we had 3 different recruitment sources. We have our customer feedback panel. This panel is made up of 600 patients and growing. These patients have volunteered to be contacted to participate in usability evaluations of this type. We also had 49 patients or customers that have called in previously with billing statement questions or issues and were open to being contacted. And finally, we have an employer group of 5 employees which have experienced issues with the billing statements. And I will be following up with them next week with the same evaluation as well as some more in-depth interviews based on their experience. So this here is a makeup of our 10 participants who participate in the billing statement evaluation. One thing I'd like to point out is the good range of ages. We have from 30 years old to 73 years old. We really try to incorporate especially the higher end age brackets whenever possible. We don't want to assume that some of the older patients, customers are as tech savvy as often the younger ones are. So there's many ways patients can pay their bill. They can pay it in person, they can mail it in, they can pay it over an interactive voice response system or the phone, and there's 2 different ways to pay online. So our one male participant preferred to pay in person with the cashier, and I believe that's because he was an employee. 5 of our participants preferred to pay online through the patient portal, My Marshfield Clinic. 1 participant preferred to pay through the other online method, and the other 3 participants preferred to mail in their payments for a variety of reasons. We learned a lot about billing statements. Here are 3 interesting findings. Patients are not seeing and therefore not reading important messages to them. A potential solution could be to relocate the message information to be in closer proximity to the account summary information. The patients were just glossing right over it. We could also use consistent color cues to highlight a message and its potential importance. Again, the patients were confused by the inconsistent use of color cues. 2, the wording of important messages is ambiguous. And this was a big roadblock across pretty much all the participants. The wording is ambiguous and the patients are not understanding the call to action the message is attempting to communicate. So a potential easy fix in this case, reword the message language to be more explicit and include specific directions and options. 3rd, patients would like the ability to set up and adjust payment plans through the patient portal, My Marshfield Clinic. a potential solution would be to review the My Marshfield Clinic functionality and see if it's possible to set up and adjust payment plans. I just recently found out it is possible to do this. So I propose to conduct further research to understand why patients aren't using the payment plan functionality offered via My Marshfield Clinic. And that will be something I bring back to the sponsor team. So next steps. Complete detailed analysis of evaluation session recordings and notes. Present findings to the billing statement stakeholder team or billing department stakeholder team. Identify any solution areas to implement and also identify who and how to execute the implementation. And further research bill payment functionality offered through My Marshfield Clinic and determine opportunity areas for improvement. So this billing statements project is an example of a very simple, straightforward usability test that we executed, and it really has the potential to lead to significant cost savings and efficiencies. And with that, I'll take any questions, and I appreciate your time and attention today. Thank you.
Great presentation, Andrea. Thank you very much. One question that we had come in actually before the webinar even started was, how do you know when you get it right? Is there a scoring methodology that you use? How do you know that you've hit the mark with your end result?
Yeah, that's a great question. There's a number of sort of checks and balances we use. So I mentioned that the literature says you can schedule 7 participants and discover 80% of the usability issues. I tend to schedule more. And then when you do that, you're able to do what we call hit saturation. So at some point, you realize you're not really coming across any new issues after you have more participants. So that's one thing. And another thing is all of the methods that I reviewed, we usually use mixed methods. And an example, not to get too technical, but we do have an eye tracker, which is very technical and high tech, and it can track your pupils. But what we like to say with that, it can tell you the what, but not the why. So for the research we do, we need to know both the what and the why. So if we just know the what of why someone's looking somewhere or not looking somewhere you want them to look on the screen, that doesn't help you without having the why. And so when we combine methods, it helps us tell us what we need to know. Hopefully that helps answer.
That does a lot, and I would just add to that as well that speaking of mixed methods, another thing we do is we combine usability assessment, design, and prototyping kind of upstream before something is created is the best situation, but then downstream after something is implemented, then we're looking at business outcome metrics. As an example, it's like, okay, for billing, are we seeing an impact on AR days, or right, or the volume of payments made through a particular channel or means. So paired with those kind of business outcome metrics, we'll do things like digital analytics too. So you could see how many people are clicking or tapping on this or that thing, and that is data that kind of interplays with this more observational data in order to make sure that things are having an effect.
Okay. Another question that came in, can you give us an example of how long this process might take? So how long does it take to do a usability test and getting all the findings and wrapping it all up?
So great question. Especially since COVID, we've been really working in what we call rapid iterations. So I've been in a cycle of, I'll use this billing statement as an example. I did conduct the testing over 10 days. The actual tests only took place on 2 days due to other projects going on. So in that case, I did the 10 participants in 2 days. Then I can do an analysis in about a week and then bring the findings back in a week. Again, this was a pretty straightforward project. It depends on the level of analysis the client wants. But so to answer your question, 2 to 3 weeks comfortably, usually, with findings.
So I think you said you had 5 different bill statements that you floated past people in the testing. If I'm going off memory from the slide that I saw, Do you have multiple things that change in that, or are you pretty much just each one has one thing that changes to try to keep kind of a level set of or control of your variables?
That's a great question too. So they were different scenarios. Just briefly, one was a pretty straightforward billing statement. Then there was a statement where you had a payment plan set up, and I asked questions about how they interpreted that payment plan and what they needed to pay. The third one was a statement where the patient had a payment plan set up, but then they had new charges that occurred after the payment plan was set up. And this is, I think, the big challenge for the billing department. The onus is then on the patient to renegotiate their payment plan, which often doesn't happen. And then the fourth and fifth statements were one was a radiology type example, and one was labeled technical and professional. And those were focused on our patients more understanding the labeling on the statements. They often use abbreviations, so they're not that straightforward where they are to people internally.
Great, thank you.
Any other questions?
Jeff, are you asking a question? I think you're on mute.
It was a brilliant question as well, and I'll wait for the answer. No, I'm sorry, because I mute on the phone and I mute on the screen. So the question was, it sounds like this is an iterative process, and it doesn't require that you have thousands of participants. You can start with a smaller group, which, going by what Andrea said, 7 participants equals 80% of your issues. And this is something that even a small company or an office or an area within an operation can implement in a fairly straightforward manner.
Yes, was that a question?
Okay. It was more, you don't need, by the sounds of it, you don't need formal tools. I mean, you don't need to buy expensive collating software and that sort of thing. You can literally implement this in a very straightforward fashion.
So I think that is true. I think there's a lot of tricks in terms of actual facilitation of the testing sessions, right? And so Andrea's expert at that. So you have to, coming from a background where I used to be doing a lot of design and watching people use the, say, software that I designed, I had to really refrain, from trying to lead them down a path, as an example. And so I think that's the trick. If you can remain objective, that's one thing. And then it depends on what you're testing as well. So, if it's something somewhat straightforward, you could definitely, approach that yourself. But when it gets more complex, as Andrea, the type of work that Andrea does, working on EHR systems and that sort of thing, that's where obviously it's a whole nother level, right? But I do think that, in terms of just talking to your customers, there's a lot of value in that, and putting things in front of them to see how they're interacting with it, understanding or not understanding of it. I think that's pretty applicable across the board.
Yeah, agreed. I would just say the most important thing is to try to, as you mentioned, Jeff, it's iterative. So try to involve it early in the development process and often.
That makes sense. I don't see any other questions here, Chris.
No, I don't see any other questions either. So we have one more minute. I just wanted to ask a quick question. So this particular project was on a billing statement, and there's an awful lot of abbreviations, jargon, and I'm sure every business, every industry has that. And you talked about how people may not understand what they're reading because the descriptions just aren't good enough. How does a company in this kind of process get around that? How do you get around the abbreviations and the jargon to make sure that your item if you have a condensed space to do it, which everything has a condensed space to do. How do you get around and actually get that done?
Well, that's a great question. We actually have someone from the vendor who generates the billing statements on the team, and he's been really helpful. And there is some flexibility with how and where things are displayed. So I will be following up with him. And as I have used him for answering a lot of questions so far, but he has indicated there is flexibility. So we'll see if we can make some improvements. And patients stated that they often compare the bills to their EOBs, their explanation of benefits, and then things make a lot more sense. But if we could even make it easier for patients to compare the two, that would be helpful.
Mm-hmm.
Yeah, and sometimes it does get into that realm of, well, there's two things I call it. One is full systems change sometimes, right? In terms of doing things like combining EOBs and billing statements to make that really clear. So, there's conversations about the impact of that, the feasibility of that, the timing of that. But the other thing that this kind of highlights is, as Andrea was saying, test early and test often. Because if you think about doing a usability evaluation with customers of, software you're going to buy or products or services from a company that you're going to partner with that your customers are going to be utilizing, you could avoid a lot of pain and expense down the road by feeding that into your evaluation, right? Of something you're going to purchase and is going to be utilized by your customers.
Good point. Good point. All right, well, we are up against the clock. I think we'll go ahead and call this one. John and Andrea's contact information is there on the screen now. It will also be included in the information that's sent out to everybody. So if you do have questions about this later and think that they can give you some insight into doing this process for yourselves, certainly give them a call. Otherwise, Jeff, I'm going to hand it off to you. I'll just say be well, everybody.
Thank you.
No, I agree. You summed it up well, Chris. Thanks, John. Thanks, Andrea. Truly appreciate your time, and I thought this was a great session. So thank you.
Welcome. Thank you.
Thank you.